Okay, let's talk about the Moyamoya disease. And the idea of this disease is constriction of the internal carotid artery. We have two internal carotid artery in both sides. Here is the internal carotid artery. Here again is the internal carotid artery. There is also the external, but it's less interesting now. And in Moyamoya disease, it's not really known, but something caused the intima layer of the blood vessel to thicken. As you can see, this thickening, especially involving smooth muscle cells, it causes slowly but with time constriction of the lumen of the blood vessel, and therefore constriction of the internal carotid artery. What happens with time is that like bypass vessels are developed in order to get over the constricted part to the brain. Those vessels are very thin and fragile and can rupture, can have constrictions, and therefore those patients with Moyamoya disease are prone to recurrent TIA, recurrent strokes, and this is the presentation usually of those patients. It can be even be in children's. So again, the intima layer, remember that when we're talking about an artery, there is the intima, there is the media, and there is the outer layer, the adventitia. Those are the layer of the blood vessel. And in Moyamoya disease, the part that is damaged is the intima layer with the smooth muscle cells that proliferate and constrict the blood vessel. It's not really known what causes it, but there are genetic predisposition to Moyamoya disease. But the pathogenesis is based on this proliferation of the internal layer of the artery, and this causes constriction. And this constriction, the body tries to overcome this constriction, so it builds those let's call it small fragile blood vessels that try to overcome this constriction in the internal carotid. But because this constriction, the patients have recurrent strokes, recurrent TIA. Now, in order to diagnose it, of course, you can use imaging, which is one of the best modalities. You can use angiography. Now, angiography is quite invasive because you need to inject a construct media to the patient and then to make an x-ray, and what you see is, as you can see here, it's like a flame. As you can see, the blood vessel that try to overcome this constriction make those puff of flame that is quite characteristic to Moyamoya disease. So it helps with diagnosis to see this constellation of symptoms, maybe patient, maybe they without risk factor even to stroke, and maybe young, with this angiography, which is the gold standard for the diagnosis. But remember that angiography is quite invasive, so not always used. Now, in talking about the treatment, you can mainly talk about bypass surgery that tries to bypass this area of constriction by using blood vessels to just overcome it. And this is more common in certain populations like Japanese and other populations that I think the Japanese are, but this is about Moyamoya disease, the disease of the internal carotid artery of the intima layer, which causes proliferation and constriction by smooth muscle proliferation. Development of those thin fragile blood vessels to overcome this constriction, which those vessels are problematic because they are fragile and prone to rupture, prone to bleeding, prone to causing CVA to the patient, prone to constrictions, prone to emboli, prone to making disease, making problems. And as you saw, as you can understand, the symptoms recurrent TIA or CVA. Diagnosis is mainly imaging. Angiography is the core standard, but it's quite invasive. And the treatment is you can use blood thinners for conservative treatment, but for definite treatment it is more surgically orientated, like bypass. Of course, you can use medication that are making the blood more thinner and less prone to clot in this very constricted area. This is about Moyamoya disease, not very common disease, quite rare. And thank you very much, and that's it.